Recognizing the member for West Vancouver Capilano.
Thank you, Madam Speaker. Healthcare providers have been on the front line of the COVID-19 pandemic from day one, risking their lives to care for British Columbians. We're grateful for their commitment and sacrifices, especially over the last 2 years. The pandemic has shed light on staffing shortages that have persisted in our healthcare system for years. It's also revealed significant gaps that should be addressed at a time when access to healthcare is more important than ever. Last month, nurses, paramedics, and other healthcare professionals missed 27,937 shifts due to short-term illness between January 3rd and 9th, according to BC's Health Minister. Hospital emergency departments were closed, and LifeLab, BC's largest private lab service provider, temporarily closed 11 locations and adjusted hours at another 5 due to Omicron. Our healthcare system has been stretched to its limits. Dedicated healthcare providers are completely overwhelmed. Many are burnt out. They need help after 2 years of working through the pandemic, and Band-Aid measures won't cut it. We need more doctors, nurses, paramedics, care workers in senior care homes, and other healthcare providers. Government must do everything it can, including putting forward a health and human resources strategy to address staffing shortages and to provide relief to healthcare workers that are stretched thin so they can continue to meet the needs and provide support to communities across British Columbia. Many families have been struggling for years to find a family doctor that's taking new patients, while others scramble when their doctor retires or the clinics close. Just recently, 3 walk-in clinics closed their doors for good in Victoria, and families are worried about who will treat them when they're sick and the vulnerable. British Columbians are frustrated about the ongoing exodus and shortage of family doctors. They've been asking for an action plan to rectify this crisis. Global TV just ran an interview today with Dr. Renee Fernandez from BC Family Doctors. She said, with population growth and physician retirement, the number of people in British Columbia without a family doctor is close to 900,000. We must fix this. BC trains 288 physicians every year. Of that, 40 to 50 choose family practice for the residency, and of that, only 15% choose to work in traditional family practice. Madam Speaker, that's only 6 to 8 doctors per year. While we're facing doctor shortages, there are an estimated 5,000 internationally educated doctors eager to work, but facing licensing barriers. Honourable Speaker, it's apparent that more needs to be done on recruitment, retention, and licensing. BC's doctor shortage is impacting our whole healthcare system, particularly compounding our 911 service and ambulance crisis. Last summer, British Columbians were left waiting hours for ambulance emergencies. A woman in Surrey experiencing a medical emergency was forced to wait for more than 9.5 hours for an ambulance to arrive. It was a time when paramedics were struggling with low staffing levels and long hours. A month before the heat dome, ECOM 9/11 data analysis concluded that BC ambulance service delays were compromising public safety overall. And by June 28, 2021, they were struggling to work with maxed out BC Emergency Health Services with more than 200 calls waiting in queue to be assigned by to an ambulance. The system is in crisis. There are reports of a significant number of psychological injuries. BC paramedics are still understaffed by up to 40% daily due to burnout, injury, and vacancies. The number is worse at times amongst dispatchers. Even then, staff have to wait 90 days to process a claim at WorkSafe BC. And we only know about this situation, which was so bad ECOM considered holding a press conference to pressure the government. Because of Freedom of Information requests, we know this. It was not public knowledge. It's clear that we have to address issues to keep ambulance workers supported and employed, including hiring more, as well as increasing government transparency, so these issues are not allowed to fester behind closed doors. And we can't forget about our nurses who have been working tirelessly to provide safe patient care. The latest November 2021 figures from the Survey of Employment Payroll and Hours show that British Columbia is the only major province to have experienced a decline in employment at hospitals during the pandemic. As of December 2021, BC had 7,500 fewer employees working in BC hospitals. This compares to 9,500 increase in Alberta, 17,000 increase in Quebec, and 15,000 in Ontario. Madam Speaker, pardon me, this reinforces news of nursing shortages and burnout at emergency rooms around the province. Thank you.